Welcome to the Board of Health meeting of Monday, April 8th. 2 members are present. I need to ask if anybody has a recording device. And if you do, you should turn it off. We'll begin with the first there are minutes that need to be accepted.
I make a motion to accept the minutes from the meeting dated March 11th, 2019.
All those in favor? Aye. Unanimous. I neglected to say that Lynn LeBlanc is missing tonight, so there are just 2 of us here. So we'll begin with the first variance, 430 Turnpike Street. Are you gentlemen?
We are.
Come on down. Introduce yourselves.
My name is Mark Worcester.
And Michael Worcester.
I could have guessed that you 2 are brothers.
Yes. Yes, we are.
So this is in regard to a property at 430 Turnpike Street. Do you want to explain?
Okay, Tim Myers, who couldn't be with us tonight, flagged the Title V inspection originally for lack of stress water usage due to the fact the system is designed for 440 gallons a day, and the average, if you look at the last page of your Title V report, which would be page 24 in your packet, okay, you'll see that it's low water usage, which is consistent, but then there was some zeros and then an 18. So that's why he flagged it. It is a 4-bedroom system, and it's been pretty much underused by what we see here, water use records. So Mr. Worcester has requested in writing to the board, because it is your policy, relief from the Board of Health policy of lack of stress. And I would invite one of the Worcesters to speak on the situation and what you're looking relief for.
So we sold the building back in September 2018, and the new owner has yet to move into the building. We installed that system new in 2007 using Bossy Construction and Todd Pilling, I think, was the engineer. So it was a Title V compliant new system that had very little use because we used that building as an office building. So there were no showers, there were no laundry, there was only just toilet use in regular cleaning of dishes. So it was very low use throughout the history of the system. So we had Jake and Easton do the Title V inspection prior to the sale. It's his opinion that it's a pristine system and that it's ready to go. It's just that we weren't in the building physically occupying it for several months prior to selling it, and now the new owner has taken an extremely long amount of time, which is his right to do, and our money still sits in escrow waiting for this Title V. So we're asking for relief from that requirement.
And in the policy, it does state, doesn't give a time limit, and it's maybe something we have to look at, but it says 3 months of water usage not to exceed 6 months. I think maybe the purpose was to kind of limit it and get this done so it's not sitting around for 9-10 months. So, I mean, but it's not written exactly that way, but I think that might have been the intent. Kristen, do you have one?
So
the intent was to see 3 to 6 months of active use, because we saw systems that sat for a year or 2 and then when put in use failed and got sued.
So that's an issue because we're being asked to assume the liability if the new owner doesn't move in promptly.
That's between
right?
the bank. It's between you and the bank.
Okay.
Title V doesn't say anything about who pays for what.
Mm-hmm.
So the money in escrow, all of that is purely a banking requirement. It has nothing
And
to
so
do with
the Title V requirements for the amount of water usage are specific to the town of Easton, not state Title V requirements, right?
That's correct. The Board of
Okay.
Health has
Right.
its own regulation that says if a building is vacant, if there is significantly reduced water flow, that it cannot pass. It has to be looked at again 3 to 6 months after normal water usage is restored. The reg was created because there were situations where this exact scenario, and as soon as the system went back online, it failed and the Board of Health was sued.
Okay.
there's no way to truly judge. The
So-
other thing I would just point out is in the past, when you've heard requests for this relief, the buyer has also been present.
Do you know when when that building will be occupied and water will be used?
We do not. The current owner has told me 3 times that they were moving in the past 6 months and has not done so. I don't know what his intent is. He could tear the building down and never use that system again. And does that mean our money sits in perpetuity? Because the Title V system that it's tied to is not going to be in use? I think it's an unintended consequence of the bylaw.
So what's our role? What are we being asked to do?
You're being asked to waive the conditional,
Not conditional, needs further evaluation.
needs further evaluation, change it to a pass.
Okay, and then do they get their money back or what?
That has to do with the bank.
Right.
That has to do with the
us.
bank and lawyers and has
Mhm.
nothing to do with us. Now,
When the new person moves in, if the system fails,
this is a what if.
Hmm?
I'm not making this as a suggestion.
Right.
If you left the faucet running and it
they
showed
don't own it anymore.
you don't
Yeah.
own it.
He's
anymore.
agreed to do that. But that's another 90 days from now if he does that. I have no control over it. I can't make him
See, it's
do
the
it.
bank that holds the money in
Right.
escrow. It has nothing to do, Title V just says do an inspection.
Mhm.
Title V says just do an inspection. That's what they're asking for.
No, they did the inspection.
We did.
Okay, it passed.
Conditionally,
No.
Okay.
because it didn't
It
have
needed
water
further
flow.
evaluation. Title V says pass, fail, further evaluation, conditional.
Okay,
Somebody fix it in 2 years. That's all Title V says.
so if they have to do another evaluation, don't shoot me when I say
No, no,
this.
no,
Who
no.
has to pay for that evaluation?
That's up to them. to
No,
figure out.
Jay Conceição has already agreed to do the evaluation when and if either we get a variance or we see water usage, which may or may not happen in the future.
Oh, brother.
I know.
This has been around since 2005. I've been here since 2009. This is the first one I've seen like this.
Okay, one more question. Where is this in relation to where the sewers are coming in?
It's not going to be
Nowhere
tight.
near.
It's nowhere near it, okay. What are you thinking?
Ready to make a motion?
Go ahead, make a motion.
I make a motion to deny the variance for 430 Turnpike Street for request for relief for the sewage disposal system.
Okay. All those in favor?
Somebody has to second it.
I second it. All those in favor? Those opposed? Nay.
I'm sorry, I missed that.
I am not, I would vote for the variance, but that's
So
not.
it's a split.
It's split.
Okay.
So
So
then
then we
what
bring it
happens?
back next month
Mhm.
when there is a full contingent.
Because you need 2 out of 3.
Unless something gets resolved between now and then.
Well, I let the buyer know that we're going to just bring suit against him for not moving in on a timely basis.
Or something like that.
Something like that.
And
Got to do what you got to do. It's okay.
Sorry,
No, I understand. I get it. Thank you.
Thanks.
Okay, moving on. Discussion regarding,
because I was going down the wrong path of the intent.
Oh, okay.
So, thank you for correcting me. I apologize for interrupting. Go ahead.
discussion regarding the petition requesting the restriction of mint and menthol products to retail tobacco stores.
So I think at this point, we're looking for some direction from the board. If you want to table it again, based on,
Well, it's also, it's my understanding that the state is also addressing this very aggressively also.
They are working on it. I don't know how quickly they are going to work on it. I was at a meeting that the Attorney General opened up last week
Right.
out in Newton. And it was more about, there was a lot of, again, very similar evidence that the mint and the menthol, especially in the vapes, make it a lot less harsh. And this particular thing I had gone to was the whole vaping issue and what the schools are dealing with. And it was then, after she opened it, it was mostly, it was a pediatrician, and then it was counselors at the high schools in Newton. So they may be moving. I haven't seen that there's anything actually in place or being proposed legitimately. I know there's a nationwide push now to raise it to 21 for all of the.
To move into smoke shops?
Yep.
Okay.
Okay, my own personal opinion is that you need the full board to vote on this.
I agree.
So I move that we table this motion.
Okay. We'll bring it back next month and bring the parties up to speed.
Second it and vote on it.
I make a motion to.
No, you second it.
Seconded.
All those in favor? Aye, unanimous. So the motion is
Table.
tabled for now. Maybe by then you'll have more information. Discussion of tobacco accessories versus marijuana accessories.
So I will be sitting down with town council again tomorrow. I think it's a similar type of topic that it's not gonna get resolved tonight anyway. I did notice myself that, the paraphernalia at the store, on Washington Street has been removed.
Good.
From a suggestion that it could be coming down the line, so they decided to do it for
To be good
themselves.
citizens.
Yeah.
Good,
Great.
good. So I don't think we need any further discussion on that.
Nope.
No. Board of Health Town Code editorial analysis recommendations, beginning on page 31. So these are the recommendations that you're suggesting.
So this is, the town code went out for editorial analysis by a private company. They identified discrepancies or things that they questioned as being relevant or typos on numerous regulations from us. Then you'll see under each one is a decision block where I've keyed in what I think should happen.
Yep.
In order to make the changes. You helped too. Yes, you did. Yes, you did. In order to move forward, what we would need to do is schedule a public hearing, advertise, and then the board would need to make those changes. So I, again, don't know if this is something you want to wait on.
Some of them are obvious.
They are.
So it's sort of wholesale. We either edit it or we don't.
We either edit it or we don't. We can edit some and
Oh,
not
we
the
can,
other.
okay.
My thing would be, based on the cost of advertising and the logistics with a public hearing, I would want to know which you want to go with.
Well, I think for the ones that are, I think you have to revise the ones that are just wrong. Like, for instance, the body art one.
Mm-hmm.
Those have to be fixed, otherwise they're meaningless. So I think you pretty much have to go with it.
Well, they don't. They were reviewed by our town council before they were ever promulgated. So blood pathogens.
I think that was just a mistake. Or maybe it was never written that way. No. What do you think?
So if we recommend the revision, that's when it would go forward to to the town, correct?
So if you wanted to move with the recommendations I've made, Mark has helped me with, we would then have town council look at them and schedule a public hearing. You'd have to hold a public hearing, advertise it in the newspaper, invite comment on any of them, and then I believe what town council will advise is that you vote the revisions on each one independently.
Okay.
Oh, and if we did nothing?
You do nothing, they just stay the way they are.
And has that interfered with the regulations?
Nope. Nope, this is something that the town clerk undertook as a review of the entire town code. They've been identified, and there are some that are obvious typos, and there are others that are a little bit more, which way do you really want to go?
I know in one of the well ones, it asked to refer to section 1, and section 1 has been omitted and taken out, so there's no section 1 in it, so let's not refer to section 1.
So it would be hard to do nothing.
Well, how long has it been, without it being a problem? These were revised in 2010.
Well, they're all different. One
They're
is
all different.
1950, one is
Body art
19...
was 09.
Hasn't heard it.
Yeah,
What do you think?
no, I agree.
Okay, I move that we keep the regulations as they're written without revision.
Seconded.
All those in favor? Aye. Unanimous.
Thank you.
You're welcome.
Heck.
All right, discussion of nursing contract.
So, one of the things I have done is look at and contact the towns that were identified as our benchmark towns when they did the when they did the operational audit in the town. There were towns that were identified that were considered our benchmarks, our comparisons, our peers. So they were Ashland, Foxborough, Mansfield, Walpole, Marshfield, Chelmsford, Canton, and Dedham were identified as alternates. I reached out to each and every one of those boards of health to find out what they were doing for nursing. I didn't hear anything from Ashland. Foxborough and Mansfield are moving over to a fire paramedical scenario, which involves paramedics filling in some of these roles. Walpole currently they had a VNA contract. It didn't work out quite the way they intended, so they've done a short-term contract with an individual who's a public health nurse in another town. And they are poised July 1st to have an 18-hour-a-week staff person going forward. Marshfield uses Norwell VNA. Logistically, I don't know that would work for us. Chelmsford has a 30-hour nurse. In addition, they have a 15-hour health educator shared with the school. Loved that idea. Canton has a 37-hour-a-week position for a full-time nurse, and Dedham has a full-time nurse.
What about the Stoughton VNA? They have their own VNA.
I don't know about them.
Yeah.
So we have a couple of different options. We could go out to bid. We write a bid package, and we have to take the lowest bidder that comes in with saying they'll fulfill our stuff. It doesn't.
You mean if you went with an agency, like Brockton VNA, not an individual?
We would have to go out, and we might get an individual who satisfies the bid. It would be open to any and all. What I think makes more sense, because if the VNAs are getting away from this, and if we're going to end up in another situation where we have to scramble again, I'm thinking that the most prudent thing to do right now would be to move forward with possibly a short-term contract nurse, either a 6-month or 1 year, and see what it's like having somebody on staff.
For how many hours?
Well, if we went, what we have budgeted in there, we could support 15 hours a week at $35 an hour. I don't know if that's enough to be attractive.
Are you insisting that a person be an RN? Could they be an LPN?
They have to be an RN to do the TB stuff.
Really?
I believe so. I think the statute says they have to be a case manager. Nurse case manager is a registered nurse designated by the local public health who has the overall responsibility of monitoring and coordinating the implementation of a patient treatment plan if we have a TB case. So it would have to be an RN.
Okay.
When does the current contract terminate?
July 1st to June 30th. That would give us an opportunity to test the waters, see what, how much work we needed, how much was free time, and kind of give us a good sense as to where we want to go, but it would put us poised to have somebody July 1st.
And would they have an office or would they work from home?
That would be negotiable. They do need to access MAVEN, which is the state's, I have to cheat and look. It is the Massachusetts Virtual Epidemiologic Network. They would have to check that daily. People at the state did tell me that there are some communities that use the nurses at the school as backups for that. So if the nurse went on vacation, potentially we could work something out where somebody at the school checks, and that's where any communicable or reportable diseases get posted, and then the nurse does the follow-up. So a lot of that work doesn't need to be office-based. They would be able to log in. There's basically a form that would need to be filled out if you had Lyme disease. They get in touch with you, get your travel history, get your symptom history, then they would contact the doctor's office. They would find out any other test results, things like that, upload the whole thing into MAVEN, and be done with it. The biggie is if we had a TB case. So if we had a TB case, statutes say we have to have an RN act as case manager, and the contact for that could go through the roof as far as the number of hours if somebody had to see somebody every single day. Just the other little things that have come up in the time that we've been looking at this. We had a situation last week where there was a exchange program that had been worked out, and we had a South African soccer team that was going to be in the school as exchange students. And Lynn was on top of it, but with Maureen, that went back and got the statutes, and basically the kids were not allowed to come into the
Because
school.
of the immunizations they had or hadn't had?
Correct. Their immunization protocol isn't the same as ours. A side issue to that is South Africa is got a good TB problem anyway. The state wasn't as concerned about that, in that it would have to be extended contact for the TB to be a real issue, and they weren't staying in homes or doing anything like that. But some of the others, measles being the big one, whether or not they have chickenpox vaccines. So these are standards that are in the statutes that had to be applied, that involved me, Maureen, and Lynn all coordinating efforts. So,
That's interesting.
yes, it's pretty interesting.
So how many hours is your nurse working now?
She's not. It's a contract. Well, not that she's not working. It's a contract. So we have a scope of services that has to be provided, including the blood pressure clinics, including our flu clinics. I probably would remove flu clinics from this relationship and then look at offering it through a contract service, the wellness company or one of those, to be able to bring it into town and have it available mostly for staff.
But not tie up her time that way?
But not tie it up in that scenario. I don't know whether we would, I'm gonna talk to Walpole again and find out how they're doing it as far as is it this short, because they're doing a short-term contract. Are they doing a set number of hours? Is the person just doing the follow-ups? Are they doing the blood pressure? It would give us the latitude to decide what was gonna work best for us. We may wanna take it down to 10 hours a week, so that we have money if something comes up, and we could write into the contract that they would be available.
So what service would Old Colony Health Services offer, like for a blood pressure clinic?
Old Colony Health Services, I'm not familiar.
The elder,
Old Colony Elder,
Yeah,
I don't think they offer any. We could possibly work something out with a couple of our firefighters, or we could have this person, I mean, our blood pressure clinics are 1 hour per week out of the month.
and how well attended are they?
4 or 5. I actually printed Maureen's last month's report, but I left it.
That's a lot of money for blood pressure.
Yep.
So is this something we're making a motion on as to?
What are we
No,
doing?
We're just
I'm-
talking, right?
Yeah, I'm just
Okay.
kind of informing you
Okay.
as to where we're
Okay,
going.
right.
Um,
Okay.
So now that's how Lynn, why you were talking to Lynn, had to do with those kids coming from South Africa.
yes,
Okay.
as the nurse in that school.
Has there ever been a TB outbreak in Easton?
We had 2 going on simultaneously in 2015. We had 2 active TVs in 2015 that were happening simultaneously.
So you can never say never. No.
Yeah, and I didn't know, I mean, until Maureen said, here's the other things, you know, that are going on. I also have reached out to Maureen to hopefully sit down with her Wednesday, Thursday, or Friday. We tried a couple of weeks ago and it didn't work out, to sit down with her too and get a little more feel if she thinks this would work, because she's
Right.
the only one who knows what the demand is right now. So,
And was she crucial to that tuberculosis outbreak in 2015?
yeah, she was meeting somebody at their house at 6 a.m. every single morning for 30 days straight. And we never saw her, and that's what I mean when I say how many hours does she do. It was a contract, she had to provide it. We never saw her an additional bill. During H1N1, when we had the outbreak, we probably spent 20 hours a week with Maureen. She sat here in the call center with us, she was on the phone with us, and we never saw an additional bill. When we do our flu clinics, when she brings in the additional nurses for the flu clinics, that's all paid, they're all per diem, but that's all on her. So we've been very fortunate to have a fantastic management company and supports with the VNA. But we were one of 4 towns being served that made having Maureen reasonable for them.
So what are the other towns that have their own nurses? Is there anybody that you could share with the way some of the other communities are sharing?
I would think, so I want to talk to Walpole because they're using somebody who also works part-time for somebody else. That's the type of thing I think would work best. But we would have to we'd have to advertise it in some scope. We don't necessarily have to go out to bid. It is, nursing services are exempt from the procurement law.
Yeah, because if Walpole's paying $40 an hour, they're not gonna come here for 35.
No, but if we're doing, if it's somebody who only wants to work, 18 hours and have another 10 on the side that they can do largely from home,
Yeah,
if you're not commuting, maybe the 35 an hour is workable.
I think that's worth exploring too.
I think it just it's a good opportunity for us. We've talked in the past about bringing a nurse on staff. I mean, I've talked in the past about having a health educator attached to the office. So it would kind of give us an opportunity to see what it looks like, see how much demand there is, and maybe write into the contract that we can use them for health education as time permits.
And where would you see the health education happening?
Anywhere and everywhere. We could design it, we could design our own program at that point. Maybe there would be one day a week that was a blood pressure clinic and was a health education on a specific topic. Some of the other towns have 1 hour targeted talks per month on high blood pressure or arthritis, or maybe the person could get involved with the vaping at the schools. Maybe the person could get involved with younger children and talking about the importance of vaccines. There's a lot of different places where there's never a lack of education that needs to be done in public health.
Right, I mean, I think the schools are pretty well covered, but I think the larger community probably isn't.
Yep, Lyme disease classes, I mean,
Don't take away Mark's.
I'm not gonna take the tick lab away.
If you're not gonna, because it's in my truck.
Okay, well, I think it sounds like, you really thought about it. And, I mean, I know July will be here before you know it, so at some point you're gonna have to act on it.
Mm-hmm. Yep,
Sounds like a good opportunity for the town, though.
yeah.
Yeah,
Yep, I just actually, it was just last week that I got back the second set of emails from the Department of Public Health. As to, they were looking into what statutorily was required. That was the other piece. It's what are other towns doing practically, but I also wanted to know what statutorily were we obligated to. And that's where the TB is the big one. Following up in Maven, I mean, I've done communicable disease reporting when I have worked in other towns. It's very hard to do when you're not a nurse because the doctor's offices don't want to share with you. They won't even take your phone calls. You don't even know how to pronounce half of the things that are being.
no, that all makes sense. And is $35 an hour in line with what other towns are paying?
It seems to be in line with what other towns are paying. $35 was Walpole, $34.50 was Chelmsford. Others didn't. When I asked for their pay scale, were like, "What's that?" But
Well, if they were willing.
like I said, I'll be talking to Maureen as well. I can find out what her per diems are getting paid because I would think it would need to be in line. Probably not as high as a per diem because we'd be guaranteeing a certain amount.
And if this person became a town employee, as you're suggesting,
Well, initially we'd go with a contract
Right.
employee.
what point would they have the town be obligated to pay benefits?
Once it goes over 19.75 hours, once you get up
Okay.
over 20.
Okay.
So there's a lot of leeway there before
Yeah.
you're actually adding a staff
Yeah.
position.
Yeah. Okay, so you ready to move on?
Yeah, absolutely.
So let's look at betterment application, 21 Depot Street. This is a letter from Christopher and Jennifer Aviles, 21 Depot Street, letter dated March 19th.
I'll speak for Tim, seeing he's not available this evening. They're going to the 25,000 and the 5,000 contingent for the total of 30,000, and everything's in line and ready to go. We just need approval from the board.
Yeah, I've been waiting a while. So you want to make a motion?
Yeah, I make a motion to accept the betterment application for 21 Depot Street and letter dated April 1st.
And I second that motion. All those in favor?
Aye.
Aye. That passes. And last but not least, the aerial larvicide.
So we get notification, they've been doing every year, they're gonna larvicide the Hockomock Swamp, before the tree canopy grows out. So it's in the packet, I'm trying to get to page 44, I don't remember the date off the top of my head, but, thank you. So, looks like we started the week of April 15th, and through the end of the month. Just want to let the board know and the people at home know that they'll be doing the larvicide. So.
And this is different than what the homeowner can request.
Yeah, that's an adulticide. This is killing the larvicide that grows in the swamps under the cedar roots. So it's a little different, and they like to do it before the tree leaves come out, and that way it's more effective. Since they've been doing this since 2011, we've had a huge decrease in Triple E and West Nile virus. 2011, 74 positive Triple E pools, worst recorded in history anywhere in the country. Last year, we didn't get any.
So this is an FYI for the community. Yeah. Good.
Great.
Yeah, so.
All right, anything else?
As we came off betterment, I'm gonna go back to betterment for 1 minute. We do have an article on town meeting warrant to request authorization to borrow another $1 million for the Mennonite Loan Program. That will just ensure that we have funding, the approval for fundings ready to go should we exhaust what we already have approvals for. We are $2.7 million either out the door or committed. It'll go up by 30,000 after tonight because we just approved another one. So we're at about 500,000 of available money. So after town meeting, we'll make sure that we still have the ability to go back and ask for more and keep it rolling.
Great. Anything from any other issues out in the community?
Working on a couple trash complaints. So I have one that I worked that went by today, and they actually picked up half the trash and put it in the dumpster at their property. So I'm going to talk to the property manager and see if he did it or they did it, and see where they're going from that. But I was pleasantly surprised to go by in the pouring rain and see half the trash was gone. It's a big pile, so they're working on it. So I have a couple trash complaints going on, and that's all I can think of off the top of my head for complaints right now that are pending. So there's been some other ones out there, but they've been closed up rather quickly. So
Good. Good. You have anything?
I'm good.
Do you want to make a motion?
Sure. I make a motion to adjourn today's meeting of the Board of Health, Monday, April 8th, 2019 at 6:37 p.m.
And before you guys leave, I want to thank Libby for 7 years of service to the Board of Health.
Ditto.
Thank you, thank you. It's been an honor to serve, and I wish the next person well,
Thank
and
you.
I wish you well,
Likewise.
and everybody. It's been an honor. So the meeting is adjourned.